You're listening to The Social Workers on WCDB Albany.
And welcome back to The Social Workers on WCDB Albany. My name is Eric Hardiman, and I'm your co-host here with Alyssa Lotmore. Welcome back, Alyssa.
Hey, Eric.
So we've got an exciting show lined up today. We've had lots of shows in the works. We've got lots coming up in the future. We've had we had a great semester last semester, great semester planned for everyone on the social workers this coming semester. And we're really excited about it. And today is just one example, but do you want to give listeners any hints about what's upcoming too?
Well, one of the things we're going to be talking about today, and I'm really excited for our guest, is Rachel Potter, who's going to be doing an upcoming continuing education workshop about COVID-19 recovery and the psychosocial challenges for patients and families. And as you were talking about this semester, getting through last semester and preparing for this upcoming semester, I think this is a really important aspect for our students, for our faculty, everyone at the university as we're going through this time of COVID. And that psychological, that psychosocial aspects, how are we addressing them? So I'm really excited for our guest today.
Great. It's always nice to talk to social workers who are working on the front lines and particularly in the time of the pandemic, who are, really out there doing the work and bringing it back to us and talking about it and sort of spreading information that's really valuable and important for the community. So let me introduce our guest today. We have with us a special guest, Rachel Potter. Rachel is a licensed clinical social worker in New York State. She's the clinical social worker at the Mount Sinai National Jewish Health Respiratory Institute. Rachel has created and led numerous patient support groups, classes, and social events. She's the developer and facilitator of wellness groups with pulmonary and critical care medicine fellows and other medical trainees within the Mount Sinai Health System. She is also trained in the use of dialectical behavior therapy. Rachel's interests include the psychosocial impacts of chronic illness, as well as faculty and trainee wellness. During the COVID-19 pandemic, Rachel has volunteered as a mental health liaison for frontline workers on COVID inpatient units, as well as running support groups for the pulmonary team and COVID outpatients. Rachel, welcome to the Social Workers.
Thank you. Thank you, Eric and Alyssa, for having me.
Well, I'm really excited for your upcoming workshop. I am registered to attend. And for those interested, it's part of the UAlbany Continuing Education Program, and it will be held on February 17th from 8:45 a.m. to 10:45 a.m., and it's titled COVID-19 Recovery, the Psychosocial Challenges for Patients and Families. So I'd like for you just to start off by talking a little bit about what you're going to be covering at the workshop and why this is such an important topic right now.
Yeah, I think the why kind of goes without saying, right? We've been living in this COVID-19 pandemic world for almost a year, and it's really impacting us in everything we do, personally and professionally and academically for those in school right now. And I think that, so my talk is going to be talking about working with patients and families who have COVID-19 and who are recovering from COVID-19, and also how we as social workers hold space for those people and work with them while dealing with it ourselves.
So tell us a little bit, before we even get further into the details about your training, tell us about your sort of entry into the social work profession. How did you become a social worker? How did you get interested in the health field? How did you kind of wind up where you are now?
Oh, that's a big question. So I originally did not want to be a social worker. I actually did bench research for a few years. And as a social worker, you can imagine that sitting in a lab, not talking to people all day, it's a very different feel. And I realized it really wasn't the right fit for me. And I was actually really burned out in that role, which is part of where my interest in burnout comes from. And I wound up working in Massachusetts under, I'm going to forget the name of the act right now, but there was an act that was passed that allowed bachelor's level clinicians to work under supervision of social workers and LMHCs and licensed mental health counselors, and to work with children and families. And we did really fun things like therapeutic mentoring, where you would, go into the community and work with a kid and help them practice social skills, or not throwing a tantrum when they went into a store and couldn't get something, really practical skills. And I loved that. And that job is what ultimately led me to going back to grad school. I went to Columbia for my social work school. And then I've always been interested in health. And so I wound up at Mount Sinai, and I was on a different position, and then joined the Respiratory Institute. And it's been a really great team to work with. And they brought me on to kind of create the social work role there, which has been really exciting.
And we talk a lot at our school, and I'm sure at Columbia too, the conversations are similar, but there's a lot of conversation going on now about the intersection of the healthcare system and social work, and the intersection of public health and social work, and the fact that social work is really kind of at the forefront of much of what's going on during the pandemic, with these multi-systems interacting with each other. That social workers tend to be the people who make those connections and who work across systems and between systems and within systems. So we're really excited to hear about what you're doing.
Thank you. Yeah, I think that for me, working in a healthcare setting, it's less stigma for somebody to get help from a social worker, because pre-COVID, I was in the clinic and usually the doctor would grab me and it would be a referral right there. So I think people felt it's less stigma than going to a therapist. I have patients that won't see a therapist. I've tried to refer out, but they'll meet with me. I agree with what you're saying. And I think part of our training as social workers is to look across systems, and that really helps in kind of building those bridges, whereas other specialties don't get that as much.
Mm.
Now, one of the things you mentioned, you said when you were originally starting out with your bachelor's that you were in a lab by yourself and it wasn't really a good fit for you. And that kind of brings me to your presentation of this social isolation piece during COVID. And when you're not in an environment that is a good match for you, and right now people are kind of stuck. I'll use my grandmother. She listens to the show, so she'll hear this. But, she's been in her house pretty much since March, and right now she's scheduled for her vaccine. But it's been a long time for just being able to do the waves outside. I mean, the first few months it was, okay, this is something new. It won't last long. But as the time went on and people still aren't able to see a lot of people in their families, and especially the elderly individuals in their families, how is this impacting people? And this part of social isolation, how do we recover?
Yeah, I think we're seeing a lot of that. We're seeing a lot more depression and a lot more social isolation in vulnerable populations. So as you mentioned, your grandmother, people who are older, and also people with chronic illness are, they're having to isolate a little bit more. And I think what's unique about COVID as opposed to other illnesses is like a cold or the flu, you can kind of control, like you take your own precautions and that's enough to prevent you from getting sick. Whereas now we're a lot more dependent on everyone around us, that they're wearing their mask, that they're keeping distance, that they're washing their hands. And I think that's a really unique and kind of scary thing about COVID. And that comes up with my patients a lot. So I do a support group twice a month for individuals coping with chronic lung disease. So it's non-COVID. And it's, we were doing it twice a month, and I offered to back it down to monthly. And everyone wanted to keep it at twice a month. I think that people were feeling so isolated that it's become a really nice space for them to connect. And also sometimes they share really great resources. So one of my patients does like a virtual a cappella group. We've done like a show and tell in the support group, and people brought different craft projects they were working on. So I think finding different ways to get that social support can be helpful. So if somebody is tech savvy, finding different groups, there's virtual book clubs, like I said, this a cappella group, all different. One of my patients told me yesterday he does Zoomies with roomies. That's what they're calling it. He's older, but it's his college roommates. They do like a monthly meetup virtually, which sounded really nice. So I think we have to be more creative about how we're getting that social support. And just while we're on the topic, I recently learned of a resource called Candoo, Candoo, and it helps seniors get tech savvy. So that might be a good resource for people listening.
I was thinking about that, Lissa, when you were talking about your grandmother, and Rachel, listening to you talking about the patients and folks that you work with down in New York City, that the tech piece and the sort of innovations that we're seeing with Zoom and with remote social interactions are maybe harder to access for some populations, whether they don't have good internet service or laptops or the proper technology. But then even when people do have the technology, they may not have the know-how, or they may not be comfortable, familiar with, utilizing these technologies. So I wonder if you have some thoughts about how to get around that.
Yeah, so I think this Candoo resource can be a good resource for people. I know with my grandparents, they're in their 90s. My grandmother actually turns 95 on Saturday. So we got them, we were lucky that we were able to get them. It's called a portal, and it's like we can do a Facebook video chat with them. So they don't really have to do anything. They just have to have it on. And my mom made a profile for them, and so then we can video chat with them. So that's been one thing that we've used in my family to communicate.
Yeah.
And I think, if people have family or friends that could come over for a short period of time and show them how to do something or set something up, simple is better. So if people have smartphones and somebody can just FaceTime them, so they just have to answer it. I think it's hard when there's financial limitations and people can't afford to have those resources. That's really been a barrier that we're struggling with.
And I was we were talking a lot about people who are older and immune compromised, but this is affecting people of all ages, and we really don't know how it affects them. And I was watching the Real Sports show was on HBO, and they had athletes on who were in their 20s and were dealing with the effects of COVID. And there was one of the WNBA players, and I had actually watched the show because of this, because I had followed her throughout her career at Louisville. And Asia Durr, she's like 23 years old and hasn't been able to play and is still having these effects of COVID. And she had said, I'm so used to, if you're hurt playing basketball, you're out for 2 weeks, and they tell you, we have a timeline for you and you'll get better. And now it's everyone saying, well, we don't know when you'll recover. So when we're talking to people and that psychological impact of sometimes not knowing when you're going to feel better, especially when your livelihood, as a basketball player, as an athlete, as somebody whose job is to be out there doing type of manual labor, how do we help people get through that time when it's just sort of, well, we don't know, we don't have a timeline for you, and how do we offer support as family members, as clinicians, to help them through this process?
Yeah. So I want to say one more thing on social isolation, and then I'll get to that, but it's related. I think
Sure.
When a lot of these people who have COVID, usually when we're sick, we want somebody to take care of us. You want somebody to bring you soup and tell you it's going to be okay. And I think the thing with COVID, especially early on, is we really didn't know. And even now it's a lot better, but we don't know who's going to get sick and who's going to get the long COVID and who's going to be okay in 2 weeks. And so I think there is a lot more uncertainty, and it's a lot scarier than like the flu or something like that. And I think the isolation of being alone when you're sick is really hard mentally for a lot of people also. and we have to be vigilant about being alone when we're sick, which is kind of counterintuitive. And so I think for a lot of these people who have long COVID, it's incredibly frustrating. And there's questions about like, how long will my recovery take, and will I be able to get back to baseline? And, I work with a lot of medical professionals too, doctors and nurses, who had to take longer than they thought to recover. And some still aren't back to their baseline before COVID. And it's a really scary, hard thing. So, as social workers, I think normalizing that for people, I think initially we didn't realize there was long COVID. And so a lot of people were faced with this stigma of, why are you still sick? You should be better. Now there's a little more information, so we know a little more. But I think part of what's so frustrating for people, and what I often remind my patients, is that we're all learning this in real time. Normally if you get diagnosed with something, the doctor says, this is what you have. This is, as you were saying, Lissa, like, this is the treatment plan, or these are your options. And right now we really don't have that. So it's kind of, we're figuring it out in real time. And I think the value of patients connecting with each other is that they sometimes know just as much, because they're looking on all these different portals and resources and seeing what other people are doing in other places. So I think connecting with others and getting support, and just kind of acknowledging the uncertainty is a big part of that.
Yeah, the uncertainty is a really interesting piece that you bring up, because I think, I mean, this whole past year, as you said, almost a calendar year now, of dealing with this, it seems like each new week, each new day in some cases brings new information. And we're learning now about new variants of COVID and ways that, we're not quite sure whether the vaccination will work with each of the new variants and how it will interact. And there's just so much new information that it's almost like a flood of constantly evolving knowledge, which is, I think, speaking from my own perspective, but also what I'm hearing in the news and elsewhere, that can be really confusing for folks and really complicated. And depending on where you're hearing your news and who you're hearing it from, and what, who you trust, and how this all kind of fits together in the big social picture, it becomes really challenging for folks. And I agree with you. I think social work has a unique opportunity to help people through that uncertainty.
Yeah. I think the different information that's coming up has been really tricky for everyone to navigate. I mean, there's been a lot of misinformation. There's been just the volume of information, and even reliable sources, because we're learning more, have said, initially they said you don't need masks. Then they said you do need masks. Then they said, you wearing a mask doesn't protect you. Then they said it might protect you, so there's been so many different things. And I think we're seeing that with the vaccines now too. In New York, I think in the state, definitely in the city, people are eager and anxious to get their hands on a vaccine as soon as they're eligible. And I think that's been really stressful and tough for a lot of individuals as well, is feeling that almost desperation to get a vaccine, and not knowing if you'll be able to get it or when. And a lot of my patients with chronic illness are really asking, when's it going to be our turn?
And we're talking about our patients, but as clinicians too, sometimes we're having our own stresses and anxiety, because we could have conditions that would have us be more susceptible to negative effects of COVID, or we might just not even know how our body would react to it. So as we're working with clients and trying to help them through this process, we still might be having our own anxieties that we're going through, and feeling some of the same feelings that they are. So it's an interesting time as a clinician, because we're all kind of in this together, really. Versus some other types of situations when we're working with clients.
Yeah, exactly. I think that's part of what makes this so hard, is we on an individual personal level are experiencing COVID, whether as a social worker, somebody's had COVID, their families had COVID, their friends have had COVID. our own fears and anxieties about getting COVID or being exposed, depending on the setting that you're in. I think we are all dealing with that in real time while we're also trying to help and hold space for our clients. And that's a really tough thing. Early on in the pandemic, somebody was talking about comparing it to 9/11, working with patients or clients during 9/11 as a social worker.
Mm-hmm.
And I think, I mean, I was not a social worker then, but I think it's a really parallel process, except that 9/11, as awful as it was a one-day event that then had ripple effects, and COVID has been almost a year-long process, which will continue to have ripple effects even after everyone's vaccinated.
Right.
Yeah.
Yeah, and it sounds like from the knowledge that we're getting that this is not something that's just going to go away, but it's something that we're going to have to learn to deal with and cope with and strategize about how to best move forward, but that it's not just disappearing.
Yeah. And as you're
Yeah,
talking,
so
as you're talking
go
about
ahead,
the,
Alyssa.
as you're talking about the ripple effects, I mean, the where social works are needed, it goes beyond. I mean, I was reading an article the other day about, you know, the effects of this on children, even if they're not getting very sick. I mean, even they were talking about the obesity rate for children has increased a little. You know, their sports have been canceled. They're not in schools, and how that can impact them and their health and the lack of socialization. I think it was one city or county in Nevada had a suicide rate amongst their students had increased. I think they were at 19 when I watched the news the other day for this time. So social workers are going to be needed in many different areas to address all of the impact of COVID. It's not just the medical, it's impacting so many different areas of life for everybody.
Yeah, I completely agree. I think that, you know, even in a medical setting, a lot of what I'm doing is counseling and is helping people cope with anxiety related to, you know, potential risk of getting COVID, and a lot of depression from the social isolation, from the uncertainty. You know, I think there's a lot of that. And I think for people who are living alone, it can be a really tough time. And, you know, for people who are living with someone, it can be equally tough in a different way. And I think to Alyssa's point, you know, we're concerned about abuse, you know, domestic violence and child abuse that's maybe going unseen or unreported because of the situations at home right now.
Right. Yeah, it's a complicated situation on so many levels. I want to go back to ask you about something you said earlier. You mentioned the word burnout, and just to sort of clarify for our listeners who thinking about it and maybe wondering what you meant by that, and sort of, you know, so could you sort of define what you mean by burnout, and then maybe talk about ways that you see that phenomenon showing up more now, and maybe what can be done about it?
Yeah, so burnout traditionally is classified by these three principles. So there's emotional exhaustion, which is kind of like each thing you get is like the straw that breaks the camel's back. It's like each thing feels bigger. There's depersonalization, which might look like a client is telling you about something they're going through and you're like, why do I care? Or, you know, they're complaining about everything. It's like it's not a compassionate response to somebody's problem. And it doesn't have to be a client. It could be a coworker or a friend. And the third one is decreased sense of personal accomplishment. So it's kind of like a loss of meaning. It's like what I'm doing doesn't matter, or, you know, I can do, even if I do more, nobody's going to notice. It's not going to make a difference. And I think that one as social workers is something that can be really hard because we're often advocating for our clients, and sometimes it does feel like it's falling on deaf ears, or we have to keep fighting the fight. So I think that's a big one for social workers. So I think burnout we talk about it professionally, but honestly, right now, COVID fatigue, COVID burnout is also a very real thing. For example, the numbers in New York are not that low. I mean, it might be better relative to other parts of the country, but compared to this spring, we're not that low. We're better than, you know, April, May, but some of the numbers, you know, have been close to June. So it's really not that great. It's just everyone's tired of hearing about it. So we think it's not as bad because we have more systems in place for how to handle it. It's become a little more normal and people are tired of it. Unfortunately, that doesn't make the virus less real. And I think that's something we might see with clients. It's also something we might feel. And so, continuing to do the work and support our clients when they're having issues around COVID, or when that seems to be the theme that's coming up for them, can be a challenge as well.
Well, that's why I think that it's so important that you're doing this workshop at this time, because sometimes we just don't know what to say or how to react as clinicians, especially when we're going through our own, anxieties about this, or our own burnout and fatigue, and having resources, or that little like, oh yeah, I remember I can say something like this, and this, just something, a resource, a toolkit to help us get through this time, especially on our own rough days when we're working. And so I just want to remind everyone that you're doing the continuing education workshop on February 17th, 2021 from 8:45 a.m. to 10:45 a.m. And you can register for that right on the UAlbany School of Social Welfare's website. So www.albany.edu/SSW, and click on the continuing education tab on the left-hand side.
So I wanted to ask you, Rachel, this is sort of a bigger picture question. And speaking as an educator and someone who works in a university system, we're seeing tremendous changes in how education happens, right? The switch to remote education has been it's been massive, and it's had massive impacts on students, on faculty, on the whole educational community. You are working in the healthcare system. What kind of changes have you seen that have come about in the last year, and where do you see those potentially, not asking you to predict the future here, but where do you see potentially the impact as we get, as more and more people get vaccinated, and the relationship to COVID and the pandemic changes? Are there going to be some lasting changes in the healthcare system that have come about because of this?
Yeah, I mean, I think definitely. I think one of the biggest ones will be telehealth. I know at Sinai, at least in pulmonary, we weren't doing really any telehealth before the pandemic. And then for a while, we switched to completely telehealth, and now it's a hybrid. But I think telehealth is here to stay. I think that for a lot of patients who are elderly or who are very ill, it's really hard for them to come in and see their doctors. And so I think telehealth is going to be a really valuable resource. And I think it's the same for therapists and social workers as well. Most of my sessions right now are telehealth. We sometimes have, I'm home today, but I'm usually in the office. There's less sirens over here. So I figured this was better for the podcast. But, I used to sit in the clinic setting more, and now I kind of sit in my office at the hospital, which hopefully that will go back. But in terms of doing telehealth, I think that's going to be something that will be more lasting. And I think for a lot of patients who have access to internet and some kind of technology to use, the barriers to entry are easier. It's easier for them to hop on a call, and especially if they live a little bit at Mount Sinai, we have a lot of patients that live out of state or live further upstate. And so if it's a big trip for them to come in, it's much easier to do a telehealth visit.
Yeah. I'm also wondering, you mentioned the power, and I'm not sure if you use that word, but you mentioned the impact of patients and people that you're working with, helping each other through, connecting socially and doing some of those things. The scholarship that I do is around peer support, and it's around the idea of people providing supports and help to each other who are in similar life situations. So I wonder, and this is just a thought, but I wonder if one of the other long-term impacts within the healthcare system might be starting to connect more patients with each other. following the pandemic, that you know, there's going to be supports and interactions that they can have that we find out are actually health promoting.
Yeah, I mean, I hope so. I think, we have a COVID recovery support group that meets monthly. And I think it's been a nice way for people to get resources and just get the validation that other people are having similar symptoms. I think you can hear it from your doctor, but it doesn't resonate as much when you hear it from somebody else who's living it, who understands it on that personal level. I think people feel much more validated and supported.
No, I agree with that. And I think it's also, I mean, everything that's going on with COVID, I think that's also going to translate into some other conditions where there is that people aren't recovering right away. I'm just thinking of a few of my friends who I know who had Lyme disease and had lasting effects, or one of my friend's children has pandas or PANS, where an infection crossed the blood-brain barrier, and they just felt like they were all alone because there's very few people who they could relate to. They were trying to find support groups nationwide. But with COVID, and people are talking about their symptoms and how they want to feel that connection with somebody, I'm hoping this helps other types of conditions where people are dealing with lasting impacts of a virus or an infection or a bacteria, and can help people connect in that way, so even those groups don't feel as alone and as isolated.
Yeah, I agree. I think it'll be a really great resource for people to have access to that and look to connect with others, especially in this time when we're so isolated and physically removed from others.
Yeah. So what's next for you? Where do you see yourself going with all of this work? Do you see yourself, what's the next step logically for you?
Yeah, I mean, I think COVID has been such an evolving process. When we first planned this grand rounds, I was like, well, we have to see what's going on so I know what will go in my talk come February, because everything's different. I think we've done a vaccine education group, but we'll probably do another one in March or April once hopefully things have opened up a little bit more for a wider group of people to get vaccinated. Mm-hmm. Like I said, we have this monthly COVID group, so we'll definitely be doing some resources on that to really help support everyone. And I do a private practice on the side, so I do some burnout support for people on the side.
Great. Alyssa, do you have any final questions for Rachel?
No, I just want to thank you and say I'm really excited for your upcoming workshop. Like I said, it's a really important timing for this right now. And I'm looking forward to going a little bit further into this discussion as you present this topic and talk about more resources and ways that we as clinicians and even, family members can work toward addressing some of those psychosocial challenges as we're going through this pandemic.
Yeah. So if you've just tuned in, you've been listening to the social workers here on WCDB Albany, and we've been interviewing Rachel Potter. Rachel's a licensed clinical social worker at the Mount Sinai National Jewish Health Respiratory Institute. Rachel, it's been wonderful talking with you, and thank you for sharing your experience and certainly for all the hard work that you're doing on behalf of the population down there in New York City.
Thank you. Yeah, it's been great to be here and to chat with both of you about everything that's been going on recently. So thank you for having me.
And Alyssa, do you want to give listeners one more time the details about Rachel's upcoming workshop?
Yes. You can find out more information on the University at Albany School of Social Welfare's website, www.albany.edu/SSW. And Rachel's workshop is titled COVID-19 Recovery, the Psychosocial Challenges for Patients and Families, and that will be on February 17th.
Great. And as always, if you want to find back episodes of the social workers, you can listen to our old shows on a variety of platforms, including iTunes, I believe. I think we've got, actually, Alyssa, you could probably list these better than I can.
Yeah, so our handle for Facebook and Twitter is Social Workers FM. You can find all our links to all our shows there, but the best way is just search the Social Workers Radio Talk Show. All our shows are stored on Simplecast, so it's the Social Workers Radio Talk Show.simplecast.com, and you can find all our previous shows and take a listen. We're on iTunes and Apple Podcasts as well.
And we've got a great semester lined up with lots more interviews and conversations to have, and a lot more education for the community. So we're enjoying what we're doing here on The Social Workers. Thanks for listening to The Social Workers on WCDB Albany.
You're listening to The Social Workers on WCDB Albany.